Greetings to everybody. Um, I'm going to be sharing a small study titled Prevalence of Malaria related to the use and non-use of insecticide-treated nets in Jakiri Integrated Health Area. Um, for the summary, as background, in Cameroon, malaria is still very endemic and the first major cause of mortality and morbidity amongst vulnerable groups. That's pregnant women, children under 5, and people living with HIV and AIDS. The use of insecticide-treated nets or long-lasting insecticide-treated bed nets is one of the recommended measures to prevent malaria. The present study was aimed at comparing users and non-users of insecticide-treated nets prevalence in malaria in Integrated Health Center, Jakiri. For the methods used for this study, we used persons who consulted in the outpatient department of the health facility between the ages of 15 to 60 years and who did a malaria test. Systematic sampling was done for the health facility and its register was used. A structured interview questionnaire was also used to get the responses of various respondents. A total of 100 respondents were elicited for the study, and a 2-by-2 table was used to determine relative prevalence in users and non-users of insecticide-treated nets. For the results, we noticed that 89% of those who owned an ITN actually were using the ITN, while 29% were not using the ITN. It was also observed that the prevalence of malaria in Jakiri Integrated Area stood at 30% in April 2016. The relative prevalence between those who not using insecticide-treated nets and those using ITNs was found to be 10.34%, indicating that prevalence is significantly higher in those not using the nets than in those using the nets. In conclusion, the results indicate that ITNs have significantly reduced the prevalence of malaria among the study population. There is, however, need for policies and enhanced supervision in the ownership and use of ITNs. For the problem statement, malaria continues to be the main threat to public health regardless of decades of control efforts made. It is a devastating disease that impedes productivity and economy of endemic countries. It makes up over 10% of Africa's overall disease burden, responsible for 40% of public health expenditure. During the last century, efforts have been made to control malaria. Amid the new advances in the control of malaria is the use of ITNs, mostly long-lasting treated nets. ITNs are known to kill mosquitoes and have demonstrated repellent properties that decrease the number of mosquitoes that enter the house. WHO has estimated that it is twice as effective as untreated nets. Mosquito net ownership is far from widespread despite the aforementioned gains. Ownership rates remain low in many malaria prevalent regions or among particular groups in malarious regions. Furthermore, mosquito net ownership in itself is not always synonymous with utilization. This therefore means that ownership is not the only obstacle to achieving the reduction in malaria morbidity and mortality associated with ITN use. Rather, people who own mosquito nets must use them in order for the potential health impacts to be fully realized. For the methods employed in this study, the study area as mentioned above was Jakiri Integrated Health Area, and the population involved is 10,833 inhabitants. For the study design, study population, and study method, a cross-sectional design was employed to include respondents between the ages of 15 and 60 years. All persons living in Jakiri Integrated Health Area between the ages of 15 to 60 years, having visited the health facility within the study period and having done a malaria test. Systematic sampling of patients was done from the register of the health facility. Every 8 patients in the register was sampled till the sample size was obtained in the month of April. For the collection tools, a structured interview guide was used to elicit answers concerning the availability and use of insecticide-treated nets. The register of the health facility provided information of the clinical diagnosis of the patient. For the data presentation and analysis, data was presented on tables and on charts. An Excel spreadsheet was used to compute data from the interview guide, and a 2x2 table was used to generate information about the relative rates, and interpretation was done. For the results, we can see from this table that the majority of the respondents were between the ages 15 to 30 years, that's 40%, while minority was between 46 to 60 years, that's 28%. This information is relevant as it demonstrates the age group that utilizes the health facility the most. This may be related to the fact that this age group is most knowledgeable and tend to handle health issues more seriously. The greatest population of respondents was female, standing at 64%, while the least were male, standing at 36%. This may imply that women fall sick more often than men, or they seek health care better than men do. This also may be related to the fact that the object of most health talks is women, and hence they are better informed. Also, women use the health facility for more often for other services like maternal and child health services, making them closer to the health facility. 89% of the respondents own a mosquito bed net, while only 11 do not. Most people own the mosquito net because of the free distribution of mosquito bed nets in 2015. Given also, as policy in Cameroon, every first ANC, a woman is entitled to a mosquito bed net. According to Cameroon News of August 22nd, 2011, the Public Health Minister announced that 2.2 persons are entitled to one net. According to the table above, 58% of the respondents had a net entitled to an average of 2.5 persons, which is slightly insufficient, while only 10% of the respondents had the right proportion of net per individual. This might be because not everyone went to collect their nets, or some pregnant women are not attending antenatal clinics, or the population increase may have had its effect. A greater majority of the respondents use ITNs. This may be related to the continuous sensitization and follow-up during home visits. A greater percentage of the population, 22%, say they use the bed nets most of the times, while least percent say they rarely use it. This also is linked to sensitization and follow-up. For the prevalence of malaria is seen to be 30%. Although high, this is less than the 50% of all outpatient consultations reported by a research carried out in Anambra State in 2013. Despite the high use of insecticide-treated nets, 67%, reported by respondents, malaria is still prevalent. There is therefore need to inquire if the prevalence is more in those using the nets or in those not using the nets. The rate of malaria according to patient results indicate that in those who use ITNs, the rates are lower, that's 0.03%, while in those using the ITNs, it is 0.86%. The relative prevalence of 10.34% indicates that the prevalence is significantly higher in those who do not use ITNs than in those who use ITNs. This indicates that ITNs is effective in preventing malaria. For the conclusion and the recommendation, from the above study, it can be observed that an impressive proportion of the population own an ITN. It was also observed that the utilization rate is not encouraging, as it stands at 67% against 33% who do not use ITN. despite the fact that